CMA co-anchor Robin Roberts has started pre-treatment for MDA. It's a disease of the bone and blood marrow. When she made the announcement Monday, Roberts said the illness was a direct result of the chemotherapy she received 5 years ago to fight her breast cancer. Should other women getting chemo be worried about a similar diagnosis? Joining me this morning is Dr. Neelima Denduluri. She's an oncologist at the Virginia Hospital Center in Arlington, Virginia. And Doctor, thank you very much for being here. I was going to ask you, are the fears valid? But you've already said you've received a number of queries from women about this.
I have. I think this is one of the most feared complications of chemotherapy. But I think it's really important to remember that this is a very, very uncommon complication of chemotherapy. Chemotherapy leads to better outcomes in women. And when we look at how women with breast cancer have the survival rates over decades, we see that they're doing better and better. And part of that is because of the advances we've made in terms of therapeutic strategies.
Even though it is rare, are doctors telling women, because the email I got, the Facebook posting I got, this is because women don't know about this and they should tell women. Are women being counseled that this could be, rare though it is, a side effect of chemotherapy?
I think that's an excellent question. In general, when we as clinicians prescribe chemotherapy, we go through with the woman the risk-benefit ratio, so to speak, and we do tell them that this is a rare complication of chemotherapy. While we probably focus more on the short-term side effects of a hair loss, and nausea, and various other things that affect them in the day-to-day, we do counsel them that this is something that can happen years later. But again, I want to stress it is a very rare complication.
Is this something, though, that women should shy away from chemotherapy? Should we go to something else?
You know, there's been a lot of press lately about the smart bombs and the tailored therapies. Yes. I think that one way that we have advanced as a breast cancer community is that we try and tailor each woman's therapy based on genomic predictors such as the Oncotype DX, that if, for example, if that comes back at low risk, then we say you don't need chemotherapy.
Right. We found that out with our colleague J.C. Hayward. Her Oncotype score was 12 or 13, very low risk. She's only getting radiation and tamoxifen.
And that's just the beginning. There are many more genomic classifiers that are going to come out. Additionally, when we're designing therapies, as you've heard about the TDM1, it targets the cancer cells more so than chemotherapy traditionally has that we use, where it targets good cells and bad cells.
Oh, we're not doing away with chemo, but we do know that we can move forward in other ways, individualized therapies, and do not be afraid to ask these questions of your doctors before you start treatment and even while you're having treatment. Dr. Denduluri, thank you for being here with us.
Thank you for having me.